Hello, my name is Komal Sheth. I am an analyst in the Data Sciences Division in the Houston Health Department. In this video, I am going to discuss how we use wastewater monitoring data alongside other types of data to inform where to target public health interventions at the zip code level. In two companion videos, my colleagues Rebecca Schneider describes the statistical interpretation of the wastewater data, and Kelsey Caden describes how we use the wastewater monitoring data alongside other types of data to inform jurisdictional level decision-making. In this next part of the video, we will be showing an example of a report that was developed using wastewater data in combination with additional data sources. The Houston Health Department compiled the biweekly COVID-19 cluster report to provide a snapshot into the areas, specifically zip codes, of Houston with the largest burden of COVID-19, as indicated across a series of metrics, including specific locations or clusters of addresses with high frequencies of positive cases. The report incorporated wastewater surveillance findings with positivity and demographic data to guide public health outreach efforts, and the health department applied interventions and services on a zip code level. This report was created in 2020 during the early peak of the COVID-19 pandemic, and while it is not being produced currently, it may serve as a template for future reports that can be developed. When first creating a new data analysis report, it is important to develop a methodology that will be used to structure how the report will be produced. The data sets that you will work with may not always be clean or organized in a way that aligns with your specific aims for the report. Therefore, sometimes you may need to develop decision rules when filtering or manipulating the data that are to be followed consistently when producing the report. For example, if the data set you are working with provides data for the whole state, but your report is targeted for your county only, then it is important that you develop a rule to filter the data to only include data for your county and ensure that this is incorporated into your process every time the report is produced. This example reflects number 3 in the Houston Health Department's cluster report methodology shown here. However, there are many other decision rules that can be added to your methodology to best fit the goals of your report. Having your methodology and decision rules clearly outlined in a way that you can refer back to ensures that the work can be replicated and that the process is being followed consistently each time the report is produced. You will also need to determine which variables you are interested in tracking as part of the report you are developing. The variables that you choose need to align with the goal of the report and provide meaningful information that can guide decision-making and interventions, and they can come from various data sources. As mentioned, the purpose of this example report was to identify zip codes with a high burden of COVID-19 and clusters of addresses with high positive case counts in order to guide public health outreach efforts in the areas with the highest need. As such, the variables chosen included the historical and 5-week positivity rates, vaccination rates, wastewater treatment plant trends, and clusters of addresses with active positive cases, in addition to other supporting metrics. When developing the list of variables you want to track in your report, it is equally important to develop a data dictionary or definitions for the variables that you are tracking so that it is clear what these variables represent. This is especially important for when these reports are shared with other individuals who may not be as familiar with the data and to ensure understanding of what is being presented in the report. Having a data dictionary additionally allows for consistency when calculating the values of these variables over time. The table shown here is a snippet of the data dictionary that was developed for the Health Department's cluster report. With this, you can see what each of the variables mean in context of the report and the data source, and what the value is based on. The data for the selected variables in your report can come from a variety of sources. In fact, using variables that come from a broad swath of data sources can provide a more comprehensive overview of how these factors may be intertwined. In the Houston Health Department's cluster report, the wastewater variables were derived from the wastewater sampling and analysis conducted by the Houston Health Department and Rice University. Wastewater analyses were conducted using R software. For more detailed information on this process, please refer to the companion video on our website, where my colleague Rebecca Schneider describes how to statistically interpret the wastewater data. Data for variables related to positive cases or positivity rates were derived from the Health Department's Houston Electronic Disease Surveillance System. This is the primary surveillance system used by the Health Department to investigate and report Texas notifiable conditions within the city of Houston. Analyses regarding historical or cumulative positivity rates, 5-week positivity rates, active positive cases, and the like were conducted by the Health Department using SAS software. Data were also geocoded using the addresses listed in heads. Data for variables related to vaccination rates were derived from the Texas Department of State Health Services MTRAC2 database, for which the Health Department has access. Analysis regarding vaccination rates were conducted using SAS software. Lastly, variables related to addresses for clusters were geocoded using ArcGIS software to identify addresses that are within City of Houston limits and to determine if they formed a cluster. Here is a de-identified example of some records and heads the system used to obtain positive case data, and MTRAC, the system used to obtain vaccination data, to give an idea of how the data is captured in these data sources. Heads contains data such as demographics, addresses, specimen dates of the test results, reporting labs, and several other pieces of information. MTRAC contains data such as demographics, addresses, vaccination dates, vaccine types, administering organizations, and also several other pieces of information. While both of these systems provide invaluable data, there are still data gaps that exist. For instance, the identifiers for unique individuals are different across the two systems, so there is not a direct way to match individuals across the data sets. To bridge this gap, we developed our own system for identifying individuals that consisted of their first name, last name, date of birth, and zip code, which allowed us to match individuals across the data sets. For variables such as overall populations, population breakdowns by demographics like age, sex, race, or ethnicity, income and poverty, and additional demographic variables, you can find this data from the U.S. Census website, data.census.gov, as shown linked here. The Census website provides a multitude of data sets, including but not limited to the decennial census and the Annual American Community Survey, or ACS. There are also several ways to search for data on the website, such as by geography, by state, by county, by zip code, or other geographical divisions as seen here, or by type of survey, topic, such as demographics, housing, income, transportation status, etc., or even year of data. Here you can see a data set, the ACS demographic and housing estimates, that can be used to obtain demographic characteristics for the population of interest. For this example, we searched for zip code 77002 and are focusing on the racial breakdowns of the population in this zip code. As documented in our data dictionary, we chose to use the top 4 races by largest racial breakdown, as well as percent Hispanic to designate our racial and ethnic groups. Once you have obtained all of your needed data from the various sources and conducted your analyses for the variables you have chosen, then the next step is to compile all of the information together into a cohesive and comprehensive report. As seen here, a large component of the Houston Health Department's COVID-19 cluster report was an Excel spreadsheet with the selected variables represented in the columns and the zip codes in the rows. We chose to share data in Excel because this software allows us to view all of the relevant variables for each zip code in one file, allowing us to sort and filter the data, and can also be used to provide summary data for additional reports as needed. It is also helpful to see the distribution of the top 15 zip codes for each week over time and identify the zip codes that show up the most frequently. This allows you to determine which zip codes consistently have the highest burden of COVID-19 and their ranking in relation to other high-burden zip codes. Furthermore, this allows you to see trends in the zip code ranking over time to see if the interventions implemented in that area are having an impact. For example, 77036, highlighted in green here, started as the top-ranking zip code for overall positivity, but over time trended downwards and towards the end of the reporting cycle, no longer even featured as a top-ranking zip code. Developing a visual to show these kinds of trends can be beneficial when determining which areas or zip codes need more focused interventions and which zip codes are showing improvement. Along with the Excel spreadsheet just shown, the COVID-19 cluster report also consisted of a corresponding document that summarized comparisons of the variable values from the current report and those from the previous report, in addition to analysis conclusions and action items. As with the spreadsheet, this document served to keep all of the analysis reports compiled in a single comprehensive report that was ultimately used to guide intervention efforts. The COVID-19 cluster report document also included spatial visualizations, or maps, as seen here. Once analysis had been completed and compiled, the report was distributed to health department leadership and executive teams. The bullet points marked here are an example of how wastewater data was used to evaluate zip code trends. Additionally, the report was shared and discussed during leadership data to action meetings and was then utilized to guide actions. For example, in order to conduct proactive intervention, data from this report were used by the COVID-19 strike team for targeted and intensive door-to-door and contact tracing efforts. If you are interested in learning more about the types of reports and analyses that can be developed to integrate wastewater and additional data sources that can inform public health interventions in your jurisdiction, please check out our other training videos available on our website linked here. Support for this program was provided through a grant by the CDC. The Houston Wastewater Epidemiology team would like to thank you for viewing this training video.